My name is Stephanie Bastian, and I will be performing a sterile dressing change. Before beginning, I have verified my orders with the wound care nurse, gathered my supplies to come in and perform hand hygiene. I'm going to identify the patient with their name, date of birth. Going to explain the procedure to the patient, administer any non-pharmacological medications or analgesics if necessary, and give time for those to kick in if I administered them before performing the procedure because it might be painful. Next, I'm going to position the patient into a comfortable position. I'm going to raise the bed up to a comfortable working height. And I'm going to expose the wound right here on their foot, keeping the rest of the patient draped. Next, I'm going to put on my clean gloves. Going to remove the old dressing. If resistance is felt, I am not going to just pull because that increases the risk for pulling and breaking the skin, causing more tear. Instead, I'm going to use a silicone-based application to help in removing. And if I'm still feeling, I'm going to use normal saline to help loosen up. Once my dressing is off, I'm going to dispose of it in my wastebasket, and I'm going to assess the wound for color, drainage, do measurements on it if needed, check for any tunneling. So I'm going to remove my gloves, put them in the waste receptacle, perform hand hygiene. Going to my sterile kit, opening it away from me. Only touching the corners. Going to get my sterile gloves. The inside of the glove. Pull that down. Once my gloves are on, I'm going to keep them above waist level. Dropping them below waist level will contaminate the sterile field and you will have to start over. Waterproof pad, shiny side down. To dump my supplies, keeping them in the center of the sterile field. Now I'm free to arrange my supplies. Pour my normal saline over my gauze. Bring a piece out. Cleaning from the inside out in a circular motion. I'm going to clean my wound. To take my Q-tip applicator, dip this and wring it out. Making sure my arm does not touch any of the non-sterile. I'm going to pack that wound in with the gauze. Bring it out, fluff it. Same thing, watching my arm. And my Q-tip to pack. I'm going to dispose of my Q-tip. I'm going to take my dry gauze, place it over my wound. Place my pad, tape that. I have applied my skin barrier before putting this down to protect the skin and dried it off. And I'm going to initial, time, and date my wound. Dispose of my sterile gloves. And clean up my supplies. I'm going to cover up my patient. Put the bed in the lowest position, making sure the call light is within reach and the side rails up. See if they need anything at this time, anything else I can get for them. Hand hygiene. And this concludes my sterile dressing change.